Now, those who are most at risk of dying from COVID-19 are getting left behind in the push to quickly distribute the vaccines. The methods being used to promote and accelerate vaccinations tend to favor people with access to technology, transportation, and spare time. According to Bloomberg's vaccine demographics tracker, white and Asian people are generally getting the shots quicker than Black and Hispanic populations. Those are the two groups that have been hardest hit by the pandemic. So with us now to discuss more about vaccination disparities is Bloomberg News' health reporter, Angelica LaVito. Angelica, thank you so much for joining us. The tracker shows that about 79% of those doses have been distributed, which is a good sign, but the most vulnerable communities are not being reached as much. Tell us some of the reasons why.
So in this push to get people vaccinated as quickly as possible and use all of the doses we have available, we're seeing some people get left behind. And a lot of states are relying on mass vaccination clinics where you can vaccinate more than 1,000 people a day. And they're relying on technological systems where you sign up and you have to refresh and search all kinds of different websites. And of course, that favors people who have time to sit and find the websites, refresh their browsers. They have stable internet. And the problem is that that leads to inequities. And so far, we're seeing it play out in the data that we have available from about 27 states and 2 cities, showing, like you said, white and Asian people getting vaccinated at much higher rates than Black and Hispanic people.
Now, you know what? Let's go straight to the states, because I saw that North Carolina, Washington, and Maine, for example, they have a smaller gap in those disparities in comparison to others. What are those states doing right that other states don't seem to be getting right now?
There's no one answer to what's going well and what's not going well, but I think that it's important to call out a few things that are working. So North Carolina, for example, they are setting aside a specific amount of doses every week, and they're targeting those towards clinics that are serving underserved communities. And then in Washington, they've already partnered with about 40 community organizations who are working with Black, Hispanic, and other minority groups in the state. And then Maine, they've taken a hard look at their data to understand why they're seeing such gaps in just the records, because a lot of people don't want to show or don't want to indicate their racial background when they go and get vaccinated. And so they've taken a lot of time to analyze that and make a push for providers to get people to share their data.
That's pretty interesting. I didn't know that it was the sharing of data that actually impeded the ability to find out who is getting the shots. But you also told me something pretty interesting right before the show, that there was a clear distinction when it comes to gender. What is this about?
So I don't have exact numbers across the country, but we are seeing probably a breakdown of 2/3, or at least a clear majority of the people vaccinated so far are women. And that's reflective of the fact that we prioritized our healthcare workers first. And we know that women make up the majority of the healthcare workforce. And so we're seeing women pulling ahead of men so far.
Now, you also saw something else interesting when it comes to the healthcare workforce and the disparities in that workforce. What did that data show you?
So we are finding, unfortunately, that even in healthcare settings where people have access, not everybody wants to get vaccinated. And we should expect that across every racial group. But we're seeing it especially in Black communities and just people who are mistrustful because of decades of discrimination and very good reasons to not trust the medical community. And so I think it's an area that everybody agrees we need to spend a lot of time working on if we hope to end this pandemic.
Right. It's an entire, ecosystem that contributes to this really huge effort. And so I want to come back out and look at the national picture. The tracker, it doesn't yet provide a full national picture, but based on what we're seeing so far, does this data tell us anything about America's path back to pre-pandemic normalcy?
Well, I think it's important to remember that disproportionately, communities of color have been hit the hardest. And so if we want to end this pandemic, we need to vaccinate these communities. And if that's not happening, we can't possibly end the pandemic.
You're absolutely right. Angelica, thank you so much for joining us.